Greetings and welcome back. This is part 2 of the lecture for week 2. Our focus is on chapters 7 and 8. The topic of discussion for chapter 7 is entitled Community, Responsibility, and Ethics. Healthcare may be viewed as a large community due to its composition of multifaceted agencies, laws, and regulations, mixed patient population, varied payment systems, stakeholders, etc. One main issue and concern of healthcare administrators and other health professionals is accountability. Health administrators have accountability on a macro and micro levels. From a public's perspective, healthcare leaders and the industry at large hold tremendous power over people and overall operations of the delivery system. Generally, Americans distrust absolute power. Therefore, through external controls, standards, and regulation and accredited entities, communities try to limit such power. Accountability in healthcare continues to increase with state and federal laws, managed care, and other mandates of the U.S. government. The use of innovative technology also increases the need for accountability. Furthermore, violations of ethics from other industries contribute to increased accountability. Healthcare administrators are charged to operate profitable businesses and retain and maintain trust in the community. In healthcare, a sense of trust is automatically assumed. For example, patients trust that you, as a healthcare administrator, will make the best decisions to ensure a positive experience in attaining health services. Patients trust that the physicians and other healthcare professionals, such as nurses, nurse practitioners, etc., are well trained and knowledgeable within their discipline to treat and provide the best level of care. The Joint Commission on Accreditation of Healthcare Organizations, better known as JCAHO, serves as an accrediting body amongst the vast community in healthcare. It is a major source of standards throughout the healthcare industry. It accredits multiple agencies in healthcare, from hospitals to home health agencies to staffing services. Through its many criterion, hospitals and other healthcare entities are held to a high standard and are accountable to produce a specified level of quality and patient outcomes. These next two slides focus on specific functionalities of the Joint Commission in greater detail. Please make sure you go back and review each point in depth. Let's now divert our attention to HIPAA. The Health Insurance Portability and Accountability Act significantly influences all aspects of healthcare, including vendors. Its primary focus is to address electronic claim submission and standards of privacy, confidentiality, and the maintenance of health information. In 2013, the Omnibus Final Rule for HIPAA was enacted, which added more regulations for health plans. This rule also addressed changes in patient communication and healthcare practices. In terms of ethical issues, autonomy and respect for patient privacy are part of HIPAA concerns. It is the responsibility of the administrator to assure that their organizations are HIPAA compliant and current upon all HIPAA regulations, and all staff and employees are aware of existing and new rules that must be implemented throughout the facility. In addition to HIPAA, healthcare administrators must remain current of multiple standards from multiple agencies. Data collection is time-consuming and the need to be accurate is high. Administrators need to understand that accountability is an ethical duty. That being said, healthcare administrators must be continuous learners to maintain accountability. Administrators must continuously assess the impact of legislation on their organizations. There is also a need to be an advocate for their organizations and for their profession. Healthcare administrators can be proactive when addressing accountability by becoming an advocate. Advocacy means that healthcare administrators are willing to educate others about their organization and healthcare administration as an industry at large. They must be current on information and active in the community. Healthcare administrators should become active in one or many of the various healthcare professional organizations out there. Such agencies may include the American College of Healthcare Executives, ACHE, the Medical Group Management Association, MGMA, or the American Public Health Association, APHA. However, many healthcare administrators may argue that I do not have enough time to do this or do that, coupled with my daily work responsibilities and tasks. Therefore, obtaining a balance between being an advocate for your healthcare organization as well as just the industry at large, it is critical, because not only will that help you to maintain good working relationships, but that is another means of keeping abreast of what is going on out within the industry beyond your organization. And that's another key point. As a healthcare administrator, you must know the ins and outs of your facility or multiple facilities if you oversee more than one, but yet you need to extend beyond that, because there are many more things that go on that has a direct or indirect impact even on how you will operate your facility. That being said, however, administrators should also consider that cost of being non-involved. If you are not involved, you're pretty much left in silo. I can speak from personal experience. There is no way that I could have been as successful, if you will, within my career had I not been involved, developed professional relationships, and networked with numerous of seasoned professionals as I began to start in the profession. Had I not worked with some of the mentors that I had and still have, I would have been lost. So again, I cannot stress to you as students and upcoming future administrators, get involved, network, attend these network events. I also forward various mixers regarding the local Tennessee chapter of the American College of Healthcare Executives. I've had Melanie to send a group information about that. So what I would like for you to do too is email me your personal email so that I can add you to my distribution list, and I will be happy to forward information that's going on in and around the city of Nashville for each of you. Being able to do something is very important. Being able to do nothing, you pretty much are going to be left standing by yourself. In addition to these organizations, maintaining contact with local and state public health departments can also provide you with information and identify various types of health trends. Joint initiatives with public health and other agencies can prevent expensive health problems. So as healthcare administrators, you can become leaders in different professional organizations as well, which I do encourage you to do so. Serve on the board, serve as chair-elect or something, but definitely get involved. All right, enough of that. Let's proceed with the next slide. We're going to look at ethics of staff competency. Another important role of a healthcare administrator is ensuring hire of competent staff and employees. The ethics duty for staff competency begins with job analysis and bona fide occupational qualifications, known as the BFOQs. Additionally, healthcare administrators should review all policies for employee selection before the hiring process, check references, and verify that people say that they are who they profess to be, and check their credentials. And one thing about it is to make sure that you treat all of your employees fairly. What you do for one, you do for all. I will share a little bit of experience with you. While I was working out in the field, I had a facility out in Michigan, and one of my providers who was serving as my psychologist, I come to learn when I obtained that facility, and I had my administrative assistant to run their credentials and their backgrounds. And I come to learn that this individual had been practicing there at the facility for 5 years. No one had verified his credentials, and he was bogus. He did not have a degree in psychology. And I just could not wrap my mind around how in the world did this guy get in here and was able to practice. He had to be licensed for the state of Michigan, and it just blew my mind. The patients that he saw, the documentation. There was one case where he even served as an expert witness. And I just do not understand to this day how he made it through the cracks and well, actually fell through the cracks and was able to put on those shenanigans for 5 years. It was crazy. But nevertheless, stuff like that, it does happen. So you as an administrator, whenever you go into a new facility or take on a new role, make sure your staff is who they say they are, and make sure they have the credentials that they are supposed to have, because when it comes for audits and reaccreditation, etc., all of that will be checked. And from that point, my staff had to not only verify people, but also do it on an annual basis to make sure that their CEUs and every type of requirement associated with your specific type of licensure was definitely intact. Actually, we had our own credentialing department who really took care of that, and most larger healthcare organizations have that. Okay, so now that we deal with competent staff, what do you do when you have incompetent staff? My example that I just shared with you was one that should be avoided, but despite all efforts, there may be times when administrators have to address the issue of staff incompetency. And there are many reasons why staff members can be incompetent. When signs of impairment exist, healthcare administrators must take action immediately. Sometimes co-workers are part of the problem because they cover up incompetence or fail to report it. Thus, the healthcare administrator must remain proactive. I always tell people it is very effective to do management by walking around, and you will be able to see a lot for yourself, develop your relationships with your employees, and then be able to really evaluate how they do things. One thing that I used to do to avoid incompetent staff, or to eliminate that, is I would spend a day with each department, definitely with each of my leaders in each department, and that would really tell me whether or not they knew what they were doing. And I would do pop-in visits and, just kind of do brief observations. Even if it was just 20 to 30 minutes out of a month or something, had to come up with some type of strategy to let my employees know that they always have to be on their toes and definitely know what they were doing. I wasn't a micromanager. I definitely do not believe in being a micromanager, But that approach was very effective for me because I was able to demonstrate that I'm a support system for you, and we began to develop a stronger relationship. That's how I really got a chance to know my employees and know who they are. And I learned them as a person. And that's something that as an administrator, and you go into any type of building, you definitely need to have the support of your staff, because you cannot do any of this by yourself. It's definitely a team effort. So if there is a work environment of trust and respect, employees may self-report situations that affect their ability. I had a little amount of staff who did that, but not much. Ethics-based healthcare administrators definitely take the time to listen. Healthcare administrators need to be able to make appropriate referrals within their existing policies and procedures. And while carrying out these functions, it is important to remember the ethics principle of justice for patients and for your employees. And definitely respect is a huge, huge factor. Now, in addition to your staff and regular employees, you yourself as a healthcare administrator must demonstrate competency. Because trust me, your team will always try you and test you. That is for sure. So an effective approach for healthcare administrators to maintain a level of professional competency within the industry is to conduct the following on a pretty frequent basis. 1, do a self-evaluation and an ethics self-assessment. This is something that should be done ongoing. And write a personal mission statement. 2, create a personal code of ethics. Participate in continuing education. And also have several mentors. There's a lot of people out there who are specialized in various areas. Get to know those people, develop relationships definitely that are specific to issues or situations that are occurring within your facility. Network, talk, share your problems, get help, get advice, seek it from others, because that will definitely help mold you to be a stronger and better professional. And most of all, stay involved within the community. That concludes the discussion for Chapter 7. Let's now take a look at Chapter 8, entitled Technology and Ethics. Technology has become part of the American culture, and it will not go away. Technology diffusion describes how widespread it is and how much it influences values and culture. Technology is also widely used within the healthcare system. If technology has high saturation, we are definitely expected to use it in healthcare. There's no way around it. Let's look at a few prominent issues related to health diffusion and saturation. Some of these issues include, but are not limited to, accommodation of high-tech demands within the industry, definitely cost, geographical distribution, and determining who gets what first. Ethical concerns related to technology in general is cost versus benefit and justice. Other ethical concerns includes patient autonomy, confidentiality, and fairness. Let's look at health information technology specifically to see how it affects the healthcare industry. The use of HIT have significantly impacted how healthcare services are delivered and greatly impacts the clinical aspects of healthcare. The HITECH Act provides incentives for meaningful use of health information. It promises greater efficiency and effectiveness. HIPAA also affects how HIT is used and protected. From an ethical perspective, patient confidentiality is a major issue for HIT. Protections such as firewalls, passwords, and access protections assist with this issue. However, the integrity of patient data remains a significant concern, especially when many healthcare agencies have experienced large health data breaches. CHS experienced that here in Nashville last year, and many others have experienced patient data breaches. So it's very important that as healthcare administrators, you definitely have a strategy in place to deal with such tragic events as those. Electronic health records. The electronic health record is not a new idea. However, it is not universal in the U.S. healthcare system. Barriers to conversion from paper to electronic records contribute to the lack of universal usage. However, specialized patient records cause concern when using EHR. Because of the nature of information captured in these records, there are greater issues of confidentiality. Legal and ethical issues require greater protections for confidentiality and release of records. And as you become involved in healthcare, you will realize that the HIM department has its own functionality, if you will. There are specific protocols that one must follow and adhere to in order to retrieve a patient's record, request information from the patient's record, etc. But all those measures are definitely needed, and I think as time progresses that the processes in those aspects will continue to become much more stringent. Let's look at some of the ethics related to EHR. The most obvious issue is violation of confidentiality or patient autonomy. Patient access to EHRs create greater convenience for patients. However, not all patients have access to the internet. The older generation, as you see here on the slide, I just kind of jotted down a few notes for you. The older generation do not use it. Many of them are challenged from using electronic devices. Therefore, non-internet users, they have greater health concerns. They refer the old paper and going in to see the provider. As research continues to grow, healthcare research is significant, but you have to always keep in mind of biases and making sure that patient information is always protected. Technology is booming, and it will continue to boom. Although it is growing and is definitely a wave of the future, emerging technologies also create ethical concerns that challenge the healthcare system, such as cloud-based storage, the use of genetic or genometric medicine, and other aspects, cloning. All of those are use of technology, but definitely challenge healthcare leaders, providers, and administrators from an ethical standpoint. These next few slides, I did leave my notes on there for you to review. Now, this concludes the Chapter 8 discussion. But before we sign off, I would like for you to ponder on this quote. It has become appalling obvious that our technology has exceeded our humanity, by Albert Einstein. What does that mean to you? References and self-assessment. Again, congratulations. This is the conclusion of Lecture 2 for Week 2. Let's see how much you remember by completing the self-assessment for Chapters 7 and 8. Remember, if you have any questions for the professor, send an email. Blessings to all.